This tip is the missing link that explains why you're struggling in your nursing pharmacology class. I'm Nicole, a professional nursing tutor with over 15 years experience, and I help you get through nursing school confidently and calmly. This tip comes from step 2 of my Silver Bullet study system. If you don't already know about it, you can get a free intro to the Silver Bullet study system video from me, as well as this lovely download. Here's your nursing pharmacology tip. When you're trying to figure out what a medication does, you are not talking about what the therapeutic effect is, and you are not talking about the reason why you're giving that medication. Instead, you need to be thinking, what is the mechanism of action for this medication? I'm going to give you an example, and then I'm going to explain why this is the missing link. Let's say you're studying a blood pressure medication. What does that medication do? It does not lower blood pressure. I know you think I'm crazy for saying that, but that's just a side effect of what the medication actually does. Instead, what the medication might do is cause vasodilation, so there's more room in the blood vessels. Now, because there's more room in the blood vessels, blood pressure decreases. When you make this subtle but very important change to studying pharmacology, you're going to find that it's easier to connect the dots to what medications do in the body, and it's going to be a heck of a lot easier to remember what the medications do. It's also going to be easier to remember the complications of a medication because everything flows from what the medication really does, which is that mechanism of action. Stack that on top of your step 1 foundational 15 studying that you do to review before you even start the mechanism of action, and your nursing school studying is going to become so much easier. Your retention rate is going to go way, way up. And you're going to finally be studying in a way that you're actually being tested. Because at the end of the day, you're being tested on clinical judgment, not facts. So being able to study based on what the mechanism of action would result in is helping you practice your clinical judgment. Make sure to give me a follow so you can get more nursing school tips. And don't forget to grab your free video about the Silver Bullet study system.